Over the past week, I have found myself reflecting deeply on what I truly wanted to impart during my equity talk. And after multiple starts and stops, my thoughts all in a whirlwind, I kept circling back to a singular piece of advice that I kept giving all of you, my peers who came to me and said they were nervous, which was speak your truth. And of course, like all good professionals, I am very good at giving advice, but not so good at following my own advice. But I am going to today try to follow my own advice and speak my truth. My truth is that I'm a queer, South Asian, Muslim immigrant. And it has taken me a long, long time to embrace both my truth and the inherent intersectionality of my identity in a world that is fraught with Islamophobia, homophobia, racism, and anti-immigrant sentiment. So what does this have to do with health equity, you might ask? For me, everything. You see, our identities, the intricate intersectionality of our lived experiences significantly shape our access to healthcare, our mental well-being, and our overall health outcomes. You know, 10 years ago, if somebody had told me that I would be working in the field of health equity, and especially LGBTQ plus health, I would have laughed at them and asked them, what are they smoking? Because I am not a medical professional. I am not someone who has all of this medical knowledge. And so I never thought of myself as somebody who could have a seat or a voice at the table, because I had imbibed this societal notion that only those who are immersed in academia or have a breadth of scientific knowledge, only they are allowed to have a voice and a seat at the table. Lived experience? What is that? What is that in the face of academic rigor, scientific rigor, and so-called evidence-based interventions, right? But all of that changed for me in 2019 when I started working at the LGBT Community Center of Greater Cleveland. What happened during that time was, well, actually goes back to before 2019. It's actually November, 6 years ago exactly today, that I unexpectedly came out to myself. I was in the middle of an interview for the program director position at the LGBT Center, and one of my future colleagues asked a question about diversity and inclusion. And I don't remember exactly what the question was. I also don't remember exactly what my answer was, but I do remember these few words that came out of my mouth, which was, as a queer Muslim woman. And then I stopped. I stopped and my eyes got big and I said out loud in the middle of this interview, oh my God, did I just say I'm queer? Wow, I've never even thought that. I can't believe I'm doing this right now. I swear I am not this unprofessional. I just never expected this to come out of my mouth. Needless to say, you know, I got myself back on track, got through the interview, and regained my composure, but that was the day for me that marked the beginning of me living into my truth. The second story that I want to share with you today centers on a healthcare experience that I had not long after I started working at the center. You see, by that point when I started working there, I had been out of care for 6 years due to a traumatic experience that I had while getting a PAP exam. The only doctor that I was seeing, and begrudgingly so, was my neurologist because I needed those migraine meds and I wasn't gonna get them if I didn't see them once a year. So a couple of months after I start working at the center, I go see my neurologist and, you know, we're making small talk, chit-chatting, and, you know, she asks me, so where are you working now? And I'm like, oh, the LGBT Center. She's like, oh, that's great. And I don't know how and why, but suddenly the conversation veered into trauma and the prevalence of trauma in LGBTQ plus populations. The neurologist went on to state that the reason that so many of these young kids today identify as queer is because of their sexual trauma. And so, of course, they wouldn't want to have anything to do with the opposite sex. This experience of hearing that statement as somebody who had recently come out and was trying to grapple with and navigate my own identity was so hurtful and harmful. To be told, or for the neurologist to imply that the reason I was queer, the reason I was the way that I was because of my childhood sexual trauma, was fucked up. And it messed me up for months. And so, of course, this interaction made me even more wary of wanting to interact with healthcare systems or healthcare providers in general. So I go back to the office, I share this experience of what had just happened with my colleagues, and I was totally expecting to be told that, you know, it was okay, don't make a big deal out of it, this is just the way it is, and because that had been my experience up to that point. But instead, what I found was my colleagues rallying around me and supporting me and affirming my experience. I was even given a word for what that experience was called, which is a microaggression. For the first time in my life, my experience was not dismissed, but was validated. Fast forward a couple of months, early 2020, before the pandemic, the pandemic that we all loved so much, the LGBT Center had moved into its brand new location, and within this new location, we had a Pride clinic. At that point, my health was really all over the place, and I knew I had to go see a doctor because I was just not doing well, just complete mess. And I was very scared of going to the doctor. The only reason that I made it through that doctor's office doors was because they were located at the center. And I had felt safe at the center. I knew if anything happened, I could run out those doors, run down the hallway into my office and scream at my executive director and say, they just tried to fuck me up. And she would come out there and she would take care of me, right? That is so important. The existence of the Pride Clinic at the LGBT Center is so vital and so critical. The providers themselves tell us that the majority of the patients they see at the Pride Clinic at the center, they would not see anywhere else because those patients would never walk through the door of a medical facility. That is where my story of my truth and healthcare converged. It drove home to me that this is what health equity looks like in practice. A significant aspect of my work at the center involves managing grants, talking to funders. Oh my gosh, I have found myself in this position so many times where I am having to educate funders and grant makers and having to push back on them when they say, well, we'd love to fund you, but the data is not there. Or do you know what percentage of the LGBT population you're serving in Cleveland? No, I don't, because that data doesn't exist. And it doesn't exist by intention. This data is not collected in any way that is consistent. There are no universal standards for how this data should be collected. And it's an intentional way of making us invisible. Because when you don't exist in the data, you don't exist in the policies, you don't exist in the funding decisions that get made. You don't even have a seat at the table. This has been, I should say, one of the key motivating factors for me that has driven me to work really hard to create a data and evaluation framework for the center. I can't address the entire larger data problem, but I can try to address it in what way I can in the work that I do at the center. And therefore, it's been so important for me during this time, during this fellowship, to utilize the connections that I've made to develop an evaluation plan and metrics based on the framework of the social determinants of health. Because it is so important for us to be able to tell our stories in a way that makes sense for us, rather than constantly trying to contort ourselves into metrics that were never designed with us in mind to begin with. I'm very proud of the fact that over the last year, we have developed a framework. I have been able to present about it. It has been validated by some of my colleagues here and others. And we have a plan and we're ready to go and implement it. But yet again, we're running into a barrier. And this time the barrier is society itself. It is the rhetoric, the anti-LGBTQ+ sentiment, the bigotry that is poisoning the socio-political landscape within which we work, that is posing the biggest risk. Because now I'm having to think about questions like, what if we get subpoenaed for this information? We're not a health providing organization. HIPAA doesn't work here. What if somebody gets their hands on this data and uses it to target my community or specific individuals in my community? With all these laws that are being proposed, which are going to make it a requirement for teachers to out students in schools, and we provide programming in schools, what does that mean for the data that we collect? And so yet again, I've had to hit pause, right? And so we're working through that with a legal team and all the rest, but it's really frustrating. And that is what I've found leadership is about. Frustration, but also persistence. You know, it took me 3 years to find a funder who was willing to fund this data evaluation project. I went from funders who said, oh, we can't fund you because you don't have the data. And when I asked them to fund us in helping us get the data, they were like, oh, we can't connect the dots, right? So persistence is key. The other thing that I've found is you have to get comfortable with being uncomfortable. It's not always comfortable to be the only voice in the room that's going to ask the hard questions or that's going to push back. Or often, as I find myself, the only BIPOC, queer, Muslim, immigrant woman in the room who's got something to say. And so you have to get comfortable with being uncomfortable. You know, people often ask me, well, how can I help? How can I support? How can I be an ally? And for me, allyship implies passivity. What I need is accomplices. What I need is people who are willing to have skin in the game. How are you going to utilize your power, your privilege, the access that you have to pave the way for us who do not have that same level of power, access, resources, or privilege? To come back to a point that I made earlier in this conversation when I was talking about identity and healthcare. For me, health equity isn't just about access to healthcare. It's about dismantling the systemic barriers that prevent individuals from leading full, healthy lives. It's about acknowledging that our identities and the discrimination we face based on those identities directly impact our health and our well-being. But this task is not just for policymakers or healthcare professionals, it's for every one of us in this room. It's in our daily interactions, in the way that we advocate for inclusivity, and in our willingness to confront our biases and preconceptions. There is great power in embracing one's truth, especially in a world that tries to box us into neat, categories that they prefer. So in our quest for equity, it's imperative to recognize the profound connection between personal truths and the broader societal frameworks that either support or hinder our journey towards a fairer, more equitable society.